Hey, what's going on, everyone? It's Dr. Chad Kuntz. I'm a sports physical therapist. Wanted to hop on because I had a really cool case study and I got his permission to share his information. So for those of you that don't know us, we're Pr1me Movement. We're a premium physical therapy and strength and conditioning based practice. We practice actually outside of a gym, or inside of a gym, I should say, with Anytime Fitness over here in Pineville. And a lot of people aren't even sure the correlation there. Like, why is a physical therapist inside of a gym? We particularly help people get back to working out despite having aches or pains, and really no matter what the age. What I'm about to show you is a gentleman who was working out. He was actually in the gym and he was doing deadlifts. He was doing deadlifts and he felt a pop in his back. It just happened to work out. We had, and this was I think 2 days ago, Wednesday, we had a reschedule. So he just hurt his back when he was deadlifting and we could see him. And we turned it into more of just an assessment. I wanted to treat him just because he was in a lot of pain. So he just deadlifted, and I want to just kind of walk you through that. So let's get into it. All right. So, and I appreciate this gentleman for allowing us to walk through his information and show kind of his story. So this gentleman was deadlifting. He heard a pop. I don't know if you guys have ever had that happen. I know I've had 2 cases where I was doing deadlifting. When I was younger, I wasn't doing the best form, and I now know why. But watch this. So what I want to show you is, let me just preface. So I'm asking him to stand and touch his toes. He's got about 5 out of 10 pain just in the middle of his lower back. Okay? So when he goes to touch his toes, that's as far as he can go. That's as far as he can go, because the moment he required the low back to bend, he was in significant pain. I mean, you can see his face. He described it as kind of a sharp, stabbing pain. And so that was it. I mean, he was miserable. He was nervous. He was frightened. And like myself, his main question is, can I work out again? Did I herniate a disc? Like, what the heck is going on? You know, he was really nervous to kind of even move and do that movement. So you could see he could do extension. A lot of clients I've seen immediately after back injuries when working out is that unfortunately they've been prescribed by healthcare professionals to do more extension. Extension, for those of you that don't know, that are watching, it's this exact motion right here that you're seeing on the left-hand side of your screen. Now, that generally people tolerate that okay immediately because it puts the spine in the closed pack position. It puts it in a stable position. So he could have done that all day, but as we went back, this was where he was having trouble. So to tie his shoes, to, whatever, just change his clothes, to grab his shoelaces, that would be murderous. So I wanted to fast forward. So here he is. We were able to see him for about 45 minutes, and there wasn't much to his story. He said he was deadlifting, he hurt his low back. And I asked, hey, would you mind if we started treating this today? And he's like, absolutely, let's knock this out. He was miserable. So the first time he goes down, you could see he's definitely guarded, all right? So he hasn't let anything bend or flex naturally the way he needs to, which is totally fine. Because if you remember over here on the left side, he was pretty much already in pain there. So he was kind of like smelling it out. And he's kind of like, hey, that's not bad. So I said, okay, what are you feeling? He goes, not much. So by the way, well, let me just kind of keep going and I'll get back to that. So this is his second rep. And look at that. Yeah, I love that face he makes at me too. He's like, hey, that's not bad. Because he also knows there's a ton of relief, confidence, mindset. Like, hey, I could do that now. I thought I herniated a disc, and actually, at first, I wasn't too sure if he did or not. So I just wanted to point out, what a difference that was side to side, okay? And the reality is that we can help people almost immediately after you hurt yourself. I really can't speak highly of my whole profession because I bet 9 out of 10 therapist might have had him do what's called like McKenzie extensions, where I'll just demonstrate it, where people are arching their back most often people are doing extensions after injury. But for him, his pain was right here, and I did massage in his lower back muscles. And after doing about 30 to 45 minutes of that, he was able to do the full range and feel a lot better. Now, he's not 100% or anything like that. But I thought that was a cool case study, and I wanted to share it with you guys. Just so you know that it's possible to help people get back to feeling better, immediately, even after they hurt their low back when working out. So if you have any questions on this, on how we actually helped him touch his toes like that after working out, just let us know below, and I'd be glad to help you guys out. So thanks so much for hopping on, and I'll talk to you guys soon. Take care.